Hi everyone, it's me, Danny. It's been a while since I made a YouTube video, so I know we're in the year 2020, brand new year. Pretty exciting as well. For me in my nursing career, I'm actually going to graduate March 6th. I will become a level 2 nurse. So at least where at the hospital I work at, there are 4 different levels. I'm considered like a novice level 1 nurse. And since I'm going to hit my 1 year mark, I automatically go into a called the level 2, and there's like a pay and raise, and we have more experience, so of course we're going to start getting more of harder complex cases of patients than we were given like in the beginning, because now there are more new cohorts coming and new grads coming to our unit, so now they have to balance that out. But I'm pretty excited to actually become a level 2. I have to admit, the beginning of my journey as a new nurse was very nerve-wracking. I wasn't sure about if I chose the right career path, if I was even good enough to do this job. And in the beginning, it's like before every shift, I'd be like so nervous, sick to my stomach, wanted to throw up, scared what would happen on the floor. And that took like about a good 7, 8 months later to finally become comfortable and be like, okay, what's my assignment? How are my patients? What do I do? What medications do I need? How do I prioritize? And yes, of course, there's going to be like those wrenches that happen. They'll be thrown in there and it's going to change your whole day, because you don't know. Someone could be nauseous, someone's in pain, someone is going to code. You don't know what's going to happen during your shift, but you try to make the best day possible and try in the end to make your patients as comfortable as possible. Because it's frustrating being in the hospital. I mean, I don't like being in the hospital. I've had my share of experience in there, so I can understand it being frustrating, people not wanting to be there. And you can't please everyone. There's some people that are unruly and just you can't please them, but you just try to be as kind as you can and just work your day through for the full 12 hours that you're there. So yeah, so it's kind of surreal now how I've grown and how I've changed how I felt about nursing. In the beginning, like I said, it's like I wasn't sure if I was good enough for it, if I if I'm doing the right things, like as if, am I doing this correct? Am I doing that correct? Like simple things. And I become more comfortable. I've learned a lot, and also I really love our unit because I learned so much from the nurses, my practice coordinators, also charge nurses, the nursing assistants help me out a lot too. I learn a lot from them as well. And it's a very good team on our unit. I'm a surgical nurse, so when I say surgical nurse, I don't work in the ER. I mean, not the ER, I'm sorry, in surgery. I don't work in surgery. I'm not there when they're doing the procedures. I get patients after they come out from the surgery, so I take care of them afterwards. I did some rotations in OR. It's funny when I see surgeons cutting the patients and I see the blood. I get lightheaded. I just want to pass out. So I knew that wasn't for me at all. But I really enjoy taking care of them after they have surgery, and then seeing the process of them getting better, and then them being discharged afterwards. So it's a good feeling to be part of that. Be part of the process of them, helping them to get better, and then afterwards they get discharged after that. So I guess the point of this video is to help with other new grads that, you know, yes, in the beginning it's going to be scary, you're going to have uncertainties, you're going to have days where you're going to cry, you're going to have, before your shift, you're going to be very nervous, calling doctors, giving report, talking to families, even talking with the patients sometimes, because you never know the patients how they're going to be feeling that day. One day they could be good, the next day they could just be grouchy and upset. It's dealing with a lot of different emotions and dealing with a lot of people, so you got to put in like a lot of different hats, put a lot of different masks. I can have one patient where they're very nice, pleasant, very fun, and then there's another patient who's crying and they're very upset and they're nauseous and they need a lot of support, so I put a mask for that. So it's like you're juggling. at least for my floor, I have to take care of 5 patients at a time. If we're out of ratio, then I might have to get a sixth. I haven't gotten a sixth yet, but soon I would be, I would, what would I say? I would be at the level where I could get a sixth patient. And it is hard, but you know, you just learn how to juggle and you provide the best care as you can safely, and you know, and don't feel bad that you can't get everything done to help the next nurse that's coming on. What the best advice I got was that nursing is the 24/7 job. It doesn't stop after your shift. So if you can't finish everything within, you know, reasonable reasonable tasks, then it's okay to pass it on to the next nurse. Don't feel bad because you forgot to pass like a simple med, or oh, you forgot to bring this patient a blanket, or you know, simple things like that. Just pass it on to the next nurse, because nursing is 24/7 and you can't do everything. If you did everything, oh my god, imagine the burnouts and how many nurses would not probably want to be in the field anymore. So it's, as you get more experience, you become more comfortable. You get to know the floor more, your coworkers. At least from my experience, my coworkers have been very good with me, so I really appreciate that. I feel like support is a really big deal, especially being a new grad. It does make a really big difference wanting to stay at the job, and you know, I want to stay there long term. I want to stay there as long as I can. I love what I do. Yes, do I have days that are stressful? Yes, there are some days where I might come home and cry. Yeah, I do. But it's just, in the end of the day, it's like, you know, my patients are safe. I took the best care as I could for them. And it's a nice feeling to just to come home, relax, get a hug from my family, and just, you know, chill. And know that I did the best that I could in helping out others in their time of need, and you know, when they need the most help, it's but being in the hospital. So if you're a new grad, don't feel defeated, don't feel like you're not good enough, that it's hard, that you're not going to get better. You will get better. You're going to get better. It's going to be okay. It will be okay. It might feel like forever, but time will go by fast, and you're going to feel a lot more, you feel a lot more comfortable, have a lot more confidence in yourself. Like an example for me is like CBI. I got a CBI patient. I'm like, I've never dealt with this before. What is this? So the night nurse told me what it was. You know, very kind. He's also one of my other colleagues from nursing school. He explained it to me. He told me what it was, what I had to do. First time, very nervous. I didn't know what to do. Second time, I already knew what to do. I felt more comfortable. So having those experiences, being exposed to something new, and asking questions, ask your coworkers, check your policies as well. Don't be afraid to ask for help. Don't It's okay to ask questions, because people know what it's like to be a new nurse. It's, you know, it's nerve-wracking. It's like, you know, you're taking care of people that trust you with their lives. So you want to do the best that you can to be safe for everyone. So it's better to ask questions than ask no questions. And again, you'll feel a bit more confident. It might feel like it'll be forever, but it won't be. And it's not going to get easier, but you'll be able to better manage and do more better time management and know how to deal with situations better than say you were at the very beginning of your nursing career as a new grad. So I just encourage you, you being new in the in the job profession as a new nurse, don't be afraid. It's okay to feel nervous. It's okay to be anxious. Just don't let that overconsume you and take away your confidence and your ability of believing in yourself. Because the first step is to believe in yourself. You gotta believe in yourself. You gotta know that you passed your NCLEX, you passed your boards, you got your license. If NCLEX didn't think you were safe, they would have never given you your license. So think of that as well. So, yeah, so happy New Year's, January 6th, so happy belated New Year's. I will make a video in possibly in March, just saying about my graduation to a level 2. Can't wait for that. So it's gonna be exciting, a little ceremony. So yeah, to all new grads, you're doing great. Keep doing what you're doing. Nursing students, you will get there. It's a long road, but whatever your journey is, just keep going forward. Don't stop. Keep pushing forward. You'll get there, and it'll be okay. It'll be okay. So you guys take care now. Thanks for watching my video. If you have any questions, feel free to message me. I'm always open to questions if needed. So thanks, guys. Have a good night, good morning, good evening whenever you're watching this video. So take care. Bye. Thanks.